Hello, viewers. Our bodies are really distinct. Even with precautions taken for our health, accidents and heredity might still have an adverse effect. Medical science was a little rudimentary decades ago, but modern doctors have developed amazing methods to conquer life. Surgical experiments have always astounded humanity. They go beyond facelifts and lip fillers. We'll be looking at bizarre, life-altering medical procedures in today's film. If your body contained two hearts, would you feel strange? Can someone survive on half of their brain? We're talking about all of that and more. Now let's get going. Stop. Let's begin with the thumb-to-toe operation. First, the toe-to-thumb procedure. How often do you use your thumbs? Have you really thought about it? You can write, button garments, brush, zip up a garment, and scroll through your phone with your thumb. Take a closer look. You'll see that it moves differently from the hand's other four fingers. It took millions of years for humans to evolve an opposable thumb. Without this thumb, the majority of your hand's functions would be completely non-existent. However, what would occur if this digit king was torn apart by an unpredictable mishap? Would it render you unable to function? Well, at first, sure. Now hear this. Doctors have discovered a way to use your toe in place of your thumb. Looks crazy, doesn't it? That's precisely what took place. Regarding UK cobbler David Lee from Nottinghamshire. In a rare accident, David lost his thumb while trimming a shoe's heel. The medical staff at Pulvertaft's Royal Derby Hospital attempted to reconnect the severed thumb right away. However, they foresaw that it would ultimately collapse. They decided that David's toe would be the best alternative. As you can see, the toe joint and the thumb act similarly. Furthermore, there was little likelihood that his body would reject this new digit. After a 10-hour surgery, a specialized team of surgeons successfully connected the big toe's arteries, veins, nerves, and even tendons to the hand. David was back at work after 6 weeks. Gradually, his skin sensation returned, and his grip also became better. He is still productively employed by the same company where he suffered his finger loss. A huge thumbs up is surely in order for this clever procedure. Stop. Another tale about odd surgical techniques can be found here. This is not another story about strange surgical techniques. Did you like hoop shooting when you were 10 years old? Besides, which child doesn't? Chris Formaker, a 10-year-old basketball enthusiast, experienced minor knee pain and edema while attending school in 2015. His parents thought that because of his active lifestyle, he had tendinitis or overexertion. However, Chris was given a rare bone cancer diagnosis a few days later, osteosarcoma. Chemotherapy, radiation therapy, and total amputation are the components of traditional cancer treatment. However, the specialists at Kaiser Permanente in Sacramento did not observe any gains using these techniques. It was then that rotationplasty, a different kind of treatment, was discovered. By amputating the thigh and leg bones at the knee joint, the tumor is fully removed during the treatment. The patient's foot and ankle are then used to replace it, rotating at 180 degrees. Chris's parents concurred as they had no other choice but to save the young child. During the procedure, the doctors repaired the skin and muscles of the ankle joint to the thigh. Chris now has his foot turned rearward to the level of the opposing knee. Although his new knee joint appeared slightly different, things were considerably easier to manage because of the prosthetic leg that slid over it. After the complex surgery, Chris was able to resume his basketball career. Listen to Chris's brief account of his life following surgery. Insert video clip here. 2.30 to 2.40. Begin at, I can conclude at, prior to my diagnosis. Stop. Wait until you hear about the next surgical marvel if this made you feel queasy. Wait until you hear about the next surgical miracle if this made you feel queasy. Recall the two hearts of the Time Lord, Doctor Who? It's possible that science brought this imaginary persona to life. There is a person whose body is beating twice as fast as the other. In 2011, Mr. Tyson Smith, who was only 36 years old, experienced severe heart failure. There was not enough strength in his heart to keep pounding regularly. A total heart transplant was the solution that cardiac surgeons seemed to be offering. However, a conventional heart transplant was not feasible. Since Mr. Smith already had pulmonary hypertension, his blood could not enter his lungs easily. Due to this complex scenario, the physicians at the Sulpizio Cardiovascular Center at the University of California, San Diego, were forced to perform a risky but usually highly successful surgery. They made the decision to get a piggyback heart transplant. This intricate procedure is known as heterotopic heart transplantation in the medical community. In place of Mr. Smith's own heart, the doctors made the decision to implant a donor heart. The surgery's sole drawback was that it had only proven effective on test subjects. However, they took the risk, and as a result, Mr. Smith lived an additional 10 years. It's true what they say, 2 hearts are better than 1. Mr. Tyson Smith's operation went quite well, and he was returning home in a few weeks. Which makes more sense? The procedure happened on Valentine's Day. The cardiac strain is now distributed equally between the 2 hearts. After 10 years, there will inevitably be some issues. Who knows, though, science might still surprise us. Stop. Do you believe that someone with only half of a brain could survive? Do you believe that someone can get by with just half a brain? This question will be addressed in our upcoming story. Everything that you do is controlled by your brain, including basic functions like breathing, moving your body, blinking your eyes, and sleeping. It also handles complicated issues, multitasking, situation analysis, and even emotions. Its 86 billion neurons efficiently perform these functions, and its 2 hemispheres, the left and the right, each regulate particular bodily functions. At age 6, Jessie Hall, a content young child, was given a Rasmussen's encephalitis diagnosis. She experienced hours, perhaps even days, of bodily shaking due to this neurological condition. Even after taking medication, Jessie's condition did not improve. Jessie began experiencing potentially fatal seizures more frequently. At that point, Jessie's parents made the decision to go from West Texas to Baltimore and the Johns Hopkins Hospital in order to get their daughter permanent care. Dr. Ben Carson, a renowned pediatric neurosurgeon, met with them at the hospital. He proposed that Jessie need hemispherectomy, a more advanced surgical procedure. He was the one who invented this process. One of the most extreme types of surgeries. This one includes removing half of the brain that is causing these terrible seizures. Strokes and Sturge-Weber-Dimitri illness are 2 more disorders that are treated with this technique. Despite their doubts about the outcome, Jessie's family decided to proceed with the surgery even though they were aware of the risks. The right hemisphere was the source of her seizures. The fact that each hemisphere is in charge of the opposing side of the body is what makes these hemispheres surprising. Thus, your left foot is controlled by your right brain. The entire surgery took about 10 hours for Jessie. And without delay, her left side became paralyzed. The family was already informed of this adverse effect by Dr. Ben Carson. Jessie's seizures unexpectedly stopped, and she began to get better. The brains of children are very neuroplastic. Compared to adults, they are far more adept at rewiring themselves to take over the functions of the damaged area of the brain. Jessie's brain began to form new connections, and she recovered rapidly with the assistance of physiotherapists. Years have passed, and Jessie is completely seizure-free. She is an average child, just like any other. She is someone who Dr. Ben Carson will never forget. When she graduated from high school 12 years later, he congratulated her on Zoom. Throughout his career, Dr. Ben Carson operated on numerous intricate cases that revolutionized the medical field. This genius was responsible for the lives of many. His life was adapted into the film, Gifted Hands, in which he performs his groundbreaking hemispherectomy procedure in a moving narrative. For a sneak peek, click the link found in the description box. Stop. Not to be overlooked, let's discuss face transplants. Finally, but certainly not least, let's discuss face transplants. Your face is what makes you who you are. It supports your ability to communicate and perform basic functions including breathing, eating, seeing, and hearing. What would happen if your face was deformed by something? At the age of 21, Katie Stubblefield made history as the youngest face transplant patient in the United States. When she was 17, she was shot and killed. Her face was severely damaged in the tragic tragedy, yet the medics managed to spare her life. She felt somewhat self-conscious about it. She even had a really hard time speaking. Her parents brought her to the Cleveland Clinic a month after the incident, when a team of plastic surgeons, anesthetists, and intensive care unit specialists began getting ready for her face transplant procedure. It took Katie 4 years to locate a suitable donor. The doctor's attention was drawn to Audrey Schneider, a 31-year-old single mother who had passed away recently. She also had her organs registered. In May of 2017, Katie's family approved the procedure. To reconstruct Katie's face and nose, the doctors created a 3-dimensional model of her sister's jaw. They selected her sister's face since they looked so similar. At some point, such model would support the donor's face. Following a rigorous 31-hour surgery, Katie's visage was transformed. She no longer worries about her appearance when she goes out in public. Her vision was severely damaged in the accident, but it is gradually getting better. We should all give these amazing procedures some applause. Have you ever considered making a change to your facial features? Perhaps contemplating Botox? You're covered by us. Check out 5 side effects of Botox injections you should be aware of, or 7 easy ways to get a slimmer face in 30 days. Proceed now. To find out more, click 1, or better yet, watch both. Did we overlook any medical miracles? Tell us in the comments section below.